Stay in the health world, and the acting Health Minister Mamoloko Kubayi-Ngubane has announced the registration date for over 50s for the COVID-19 vaccine. But she has expressed concern about the lack of registration of over 60. She was briefing the media earlier about the national vaccine rollout program, and I'm joined now by Heidi Giokos. Heidi, you mentioned it first on this show last night, saying that the Premier of Gauteng had hinted that the rollout to over 50s, the registration would begin next week. So now we know it's going to be registration opening for over 50s from the 1st of July. Extremely good news.
Yes, certainly, Sally. This is fantastic news for those that are 50 and above. Unfortunately, I do not fall in that category. But we do know that those that are 50 and above will be able to register as of 1 July, and vaccinations will begin from the 15th of July. The reason for this could be attributed to the fact that the country is, of course, receiving more vaccines, but also because they're seeing a low turnout in the category 60 and above, but also the pressure that is on government to vaccinate as quickly as possible, looking at the alarming infection rates of COVID-19, particularly in Gauteng. And the acting Health Minister Mamoloko Kubayi-Ngubane is saying that it's imperative for vaccines to happen as quickly as possible. We know there was a deadline to vaccinate 5.5 million 60 and above by June. Of course, that deadline is not going to be met. But it seems as though government realizes that there is mounting pressure to vaccinate quickly due to the fact that the numbers are just so alarming. But let's listen to the acting Health Minister on those details.
From the 1st of July 2021, we will open registrations for all citizens which are between the ages of 50 years and above, and we will also schedule those vaccinations to begin on the 15th of July. I encourage all the citizens to register and get their vaccine. If you have a friend, a family member, a neighbor, or a loved one who is at 60 years and above, especially as senior citizens who are battling to get move around in terms of mobility, please bring them along in terms of your vaccination centers so that you can help them. And we are hoping that in the families, this will encourage all of us to take our parents, our grandparents, our loved ones as we go to the vaccination sites.
Yeah, so it's really good news that more and more cohorts, that's the word that I kept hearing this morning in that briefing, are now going to be eligible to get the vaccinations. Over 50s can register from the 1st of July. And of course, we are hearing about more and more groups are going to be specifically targeted. And all of this, of course, on the back of the news that more vaccines are suddenly starting to arrive, which is fantastic news. Can you tell us more about that, Heidi?
Yes, certainly, Sally. So we do know that more vaccines are expected to arrive in the next coming days and the next couple of weeks. July is a big month for South Africa to get more Pfizer vaccines and Johnson & Johnson. We do know that a big consignment of Pfizer arrived last night. And the acting health minister saying that before there was concern that there weren't enough vaccines because of that holdback of the 2 million Johnson & Johnson vaccines. But now there are more vaccines arriving. And this is also what's prompting government to say the vaccines are available. We should be opening up to other cohorts, as you mentioned, and other categories, because the demand is there and the concern is also there because of the alarming numbers in the province. But what's interesting here, Sally, if we're going to listen to the minister now, who speaks about there's an expiry date for August, but they do believe that they will meet the deadline to vaccinate as many people as possible before that expiry date in August. Let's listen to the acting health minister.
But so far, Pfizer has delivered nearly 4.5 million doses as promised in Q2. They have also committed just over 15.5 million doses in Q3, of which we are expecting nearly 2.1 million doses in July. Johnson & Johnson have so far delivered 500,000 early access doses used for Sisonke, 300 market doses last week, and 1.2 million doses landed last night in the afternoon, ladies and gentlemen. These doses all need to be used by 11 of August, and I think we are on track in terms of working to ensure that we utilize these doses. But we are waiting confirmation for delivery of 500 doses, and this then will make up 2 million to replace those that were affected in terms of the continuation that we announced last time. With this flow of vaccine, we will be able to press ahead with the vaccination of frontline workers, sector by sector, and I do want to confirm that we will then move on to workplace vaccination, both formal and informal sectors like the taxi industry. We will take guidance from the IMC on COVID-19, together with the MEC, on which of the sectors to prioritize, and moving along until all work-based vaccination are completed.
And this is certainly encouraging news after so many delays and problems. Could we finally be moving into the full throttle of our vaccination? I mean, it sounds great, but also what came out of the media briefing this morning is that those aged 60 and above, not as many people came for their vaccinations as they had hoped. I think it was 50% or thereabouts. And it's not, interestingly, people who don't necessarily have access to vaccination sites. It seems that this issue of vaccine hesitancy is causing real issues.
Certainly, Sally, and we do know that they were expecting to vaccinate 75% of those that are 60 and above before they moved into other categories and other age groups. But it seems as though people are not registering as expected and anticipated, and also they are not seeing as many walk-ins. We do know that here in Gauteng, public vaccination sites were calling for those who are 60 and above to get to the nearest public vaccination site and get their COVID-19 vaccine. And Gauteng is actually one of the provinces where they're seeing a very low number, and the numbers are actually dwindling in terms of registration and actual vaccines administered for 60 and above. What's interesting here is that Limpopo, the rural and remote areas, are seeing a large number of registrations and vaccinations, and everybody thought that there would be a concern and a very low number. KZN as well, we do understand in the rural and remote areas, high number of vaccines administered. So we know that the Department of Health is saying that they need to relook at this. It could be because of hesitancy, it could be because they don't have access to technology, but of course they're trying to deal with the matter as urgently as possible.